The topic that I chose to present on was how a 5-minute test could help to detect dementia 10 years before symptoms arise. Researchers from University College London say that a 5-minute neck scan can detect a person's risk of developing dementia 10 years before there are any signs of symptoms. The test, which uses ultrasound scanners, measures the strength of the pulses from the blood vessels in the neck. So essentially, it measures the amount of blood flow to the brain. In this specific study, scientists looked at over 3,000 patients between the ages of 58 and 74. Along with the ultrasound test, the patient's cognitive functions, such as memory and problem-solving abilities, were also monitored for 14 years, from 2002 to 2016. Researchers found that the patients with the strongest or most intense pulses were up to 50% more at risk or more likely to develop dementia. This is because the irregular and intense blood flow puts people at risk of damaging the brain's network of blood vessels. In addition to this, the pulses become more intense when arteries surrounding the heart aren't working as well as they should and can no longer cushion the blood flow. This is usually caused by lifestyle choices, for example, drug use and diet. The researchers that participated in this study believe that this is why the patients who experience cognitive decline were more likely at risk for developing dementia. Overall, the test would serve as a fast and easy way to assess people who may be at risk for developing dementia. Dementia as a degenerative disease is irreversible, so it's important to monitor patients that may be especially at risk. In addition, researchers agree that it would motivate patients to make a better assessment of their lifestyle choices. Monitoring blood pressure and cholesterol are especially important, while maintaining a balanced diet, regular exercise, and not smoking are also all preventative measures. Next, researchers plan to use MRI scans in order to see whether or not the patients with the stronger pulses and with the cognitive decline also show structural changes in the brain.